The room is filling up. Welcome, everybody. Thank you for joining us today at this Lowell Community Food Assessment virtual panel roundtable. Just take a few minutes, let people shuffle in, and if you can, drop your name into the chat and a greeting or an introduction of any sort that feels good today. And we're also going to be using the chat as a place to leave comments or questions throughout the discussion today, and we will have a chance at the end to come back to those questions. So please, please do leave those there. All right, we got some people in the chat. Hi, Howard. Hi, Janine from Maynard. Thank you for joining us. Irene from Immaculate Food Bank. Hi, Kim from the First Religious Society of Carlisle. Thank you for joining us. Hi, Linda from REACH LoWELL, and Sarah. Good to see everybody. Well, I can't see you, but I'm glad to see you here. Hi, Emma. And Sandra from UMass Lowell Nursing, Diane from Fallon Health Space Program. Wonderful. Well, we are going to go ahead and get started. We have a lot of great conversation to jump into today. And so we want to use our time and make sure we get to hear from everybody. So I'm going to go ahead and start with introductions, and then we'll jump into it from there. So welcome. My name is Francey Slater. I use the she, her pronouns, and I am one of Mill City Grow's co-founders. And I am thrilled to be here today as the moderator for this discussion about the 2022 Lowell Community Food Assessment. We have some incredible panelists here today who are going to be sharing their perspective, their knowledge, their expertise about community health, about Lowell, about food, and we're really thrilled to present this to you today. Just a quick definition of what is a community food assessment. Many of you may be familiar with this, but some of you may not. So just a few things that a community food assessment really aims to do is to gather information about residents' perception of the food environment and their food shopping and consumption behaviors. So gathering that first person information, and then taking that information and using it to inform community organizations, nonprofits, as well as policymakers who want to improve healthy food access. And the last thing that a food assessment does is raises awareness of food systems, assets, deficits, and opportunities, while creating a platform that residents can use to advocate for effective policy and programs to meet community needs. So those are a few of the big goals that a community food assessment sets out to achieve. And there's a lot of different ways to do it. But what we did here in Lowell, you'll hear a lot more about today, really centered on elevating the voice of residents and really focusing on people's lived experience. A little bit of history about the CFA is this is our second community food assessment in Lowell. The first community food assessment was conducted in 2011 and 2012 and was published in 2013 by my partner at Mill City Grow's Lydia Sisson. It was her master's thesis project at UMass Lowell. And that CFA was really the genesis of Mill City Grow's. Much of the research and the findings that are included in that CFA, that original CFA, were directly responsible for Mill City Grow's starting up and creating community gardens and farmers markets and really focusing on food access, healthy food access in Lowell. And so it really felt like the 10th anniversary of Mill City Grow's, which is this year, was the right time for another CFA. And so for me to be able to participate in that CFA as the co-founder, I got to work with Ali Jacobs, who you'll hear from today, and so many other amazing community members to put the CFA together and bring it to life. It was really an honor and just an incredible experience. And I'm thrilled to be here today to guide this conversation and really hear about what people on this panel had to contribute and learn from in doing this CFA. So I'm going to pass the mic now to our next panelist, Solimar Barrios. You're on mute, Solimar. You can't unmute. Let's see.
There. Hi, everyone. My name is Solimar Barrios. Thank you, Francey, by the way, for the introduction. I work for Mill City Grows as the head of office operations. This is my 3rd year, and I work all aspects of programming and administration at MCG headquarters. And last year, I was a CFA committee member. And I was able to conduct focus groups and outreach in the Latin community. So thank you very much. I'll pass it along to Jen Morel.
Hey everyone, my name is Jean Marlee Gonzalez. I'm the REACH LoWELL program manager at Lowell Community Health Center. So REACH LoWELL is a CDC-funded project led by Lowell Community Health Center. It stands for Racial and Ethnic Approaches to Community Health. And it's a coalition of organizations that come together to work towards a goal. And we're working towards reducing disparities among Southeast Asian and Latinx communities when it comes to diabetes. And so my role with the CFA was really in our nutrition strategy, where we work closely with Mill City Grows and other partners in the planning process and really in the implementation of the CFA. And I'll pass it over to Tara.
You go. Well, hi everyone. Thank you so much thank you to everyone for being here with us tonight. This evening, very nice out, a little bit cold, but very nice out. And thank you all the panel and Mill City Group will put this together. My name is Tiara Hong. I am currently working at Lowell Public School as a portrait of graduate project manager, and also a board member for Mill City Group as well. And this year, I'm also a candidate for state representative in 18 Music as well. I pass on to Ali.
Hi, everyone. My name is Ali Jacobs. I'm the director of programs at Mill City Grows, and along with Francey, I was one of the project leads on the community food assessment. So really spent the last 18 months working on this project along with everyone who's on this panel and a lot of the people who are in the chat as well. And I'm sitting here with the incomparable Edith.
Hello, everybody. A warm welcome. I'm delighted to be a part of this incredible group of people. My background of nursing, public health, and a chef has inspired me to cook only for the homeless in the city of Lowell. And with the support of this group and the hopes that we can do even more, I look forward to continuing working with this group. Thank you so much.
And Edith also served on the steering committee for the community food assessment. So I'm going to just talk a little bit about the project generally. Francey sort of defined the community food assessment and why we did it. A few different things that we might talk about today include the food system. So the food system in the way we defined it for the community food assessment, which is not always the way that it's defined, the way we defined it was really everyone who ever interacts with food for any reason. So that includes the producers of food, who are usually included in the food system conversations. So that's farmers, ranchers, fisheries, anyone who's actually creating food from the natural elements that we eat. Then you also look at the whole packaging, washing, distribution chain, food manufacturing, all of those middle places where food goes before it comes to the places where people engage with it. So that includes shipping, either by boat or plane or over ground shipping. It also includes food manufacturing, so where ingredients are turned into either shelf-stable foods or packaged foods, frozen foods. All of that would be considered food manufacturing. And you're also looking at the retail systems and the institutional systems that get food to people. So some people go to stores to purchase food. Some people are getting them through emergency food distributors. Some are getting them through institutions such as schools or hospitals, rest homes, and various other places where you are eating as part of your residency there or as part of your work there sometimes. And then literally every single person who eats, which is every person, is part of the food system as well. So the consumers, people who are buying food, cooking food, eating food, getting food through emergency food systems, getting food through institutions, all of those people are also part of the food system. And that's often a part of the food system that gets a little overlooked or really put into specific classes when it's obviously the broadest part of the food system. We also had a very specific definition for food security. So a lot of people think of food security as having enough food to eat. And we certainly agree that if you don't have enough food to eat, then you are food insecure. But we define food security more broadly as you are food secure if you have enough food to feed your family every day. If that food is accessible to you financially and geographically, it's close to you where you live, and you have the ability to get to it. It's food that supports your health and positive health outcomes for you. And it's food that is relevant or connected to your culture, food that's familiar to you. And it's also food that you want to eat. And we know that there are young people who want to eat Takis. And so that's like, people are like, it's not always about what you want to eat. But there's a lot of people who make really difficult decisions about what kind of food they're going to get. And they end up getting food that they don't really want, that's less desirable for themselves and for all of the factors that I just listed, because they don't have the funds or the access to get the food that they actually want and need. So that's the broader system of food security that we've used throughout this process. And that was from the very beginning of the community food assessment. It really drove a lot of the work that we did in the assessment. But that also ties us to how we approach the project generally. So we approach the project through the lens of equity and systemic racism. So we know that our food system has been formed with racist practices, with unequal practices, so that different people have different access to food or different ability to purchase food based on policies that were created that are specifically excluding people of color. And when we were talking about how do we do an equitable assessment in the city of Lowell, we said we really have to focus on the communities that are not often focused on here. We need to focus on the communities that are having the hardest access points. They're having the most excluded access points and have been historically excluded. So we focused on communities of color. We had a very strong focus on Southeast Asian and Latinx communities. We had a very strong focus on immigrant and refugee communities. We had a strong focus on the unhoused community. We also worked with a lot of youth and seniors. And we focused a lot on families with children, especially those using food benefits, because those were people who we wanted to really make sure that we were capturing what does it look like when you have a lot of these difficult decisions that you're making? What does it look like when you have been intentionally and historically excluded from processes that promote healthy and easy food access? To do this, we had a lot of different methods of doing outreach to these communities. So Francey and I, for one, are only two people, and we're also two white people. So we wanted to make sure that we were not the ones going out everywhere and doing all of the outreach. So we worked with a ton of community partners, many of whom are on this call with us. And a lot of that was through the REACH LoWELL coalition and through a lot of the people in the chat as well. So working with the already established community leaders in Lowell who already have a lot of contacts and community members who are in these populations who are having difficulty accessing food for whatever reason, who have been excluded from food access. And we did a bunch of different methods of getting people's input because we knew that different people would want to respond to us in different ways. We did a survey of residents. So over 1,000 residents actually responded to our surveys. We did get some from online, but we had a ton of paper surveys. So paper surveys went out to the senior center, to the food pantries, to the soup kitchens. They went out to churches. They went out to the community health center. All across the city, people were doing paper surveys, bringing them back to us. We had interns inputting the information. We did over 30 individual interviews. We hosted 7 focus groups in, I think, 4 different languages. We did a survey of producers and farmers in the region. We also did a survey of local nonprofits and emergency food providers. And we did an assessment of the retail stores, the grocery stores in Lowell. We actually went into 86 of the physical stores and did an assessment of them all across the city, focusing largely on the lowest income neighborhoods in the city. So that would be Centerville, downtown, the Acre, and South Lowell was where we focused a lot of that assessment. After collating all of this information, and Francey and I looked at it in her living room in Vermont in October, and we really saw a bunch of trends coming out from people's feedback. So the recommendations that we made in the community food assessment were actually based on real recommendations that were given to us by the public. Very, very little of that actually is coming from anyone who's working in the nonprofit industry or anyone who's working in the food system, or rather who's employed by the food system. It is largely coming from the residents and from the focus groups. And what we did is we collated similar responses and put them together. And those major recommendations areas, the first one was just that the very biggest, and by a huge margin, the very biggest factor in accessing the food that people want and need is affordability, which in itself was not a big shock, but the avalanche of responses and the margin by which that was at the top, I think was a little shocking. We also got a lot of recommendations about retail, about having more produce available at retail locations throughout the city, about people wanting to be able to spend their benefits more easily at retail locations, and about people wanting more produce. I'm sorry, I already said that. About people wanting actually more local, organic, and sustainable food at retail locations. And often people think that organic and local and sustainable produce is something for wealthy people. But we had people who were identifying themselves as lower income, who were saying that they were having food insecurity and various issues, and they still want the organic, local, and sustainable. So we were really looking at shifting that perception of that being something for the wealthy and not for everyone. We also got a lot of feedback of people being interested in more urban agriculture access. So having space where they can grow, and then also having more education about how to do that and how to do it safely. We also got a lot of feedback about people just looking for education generally, how to shop, how to plan meals for the week, how to do a lot of prep work, how to save time in the kitchen. Some people didn't think that they were good enough cooks to cook at home or felt overwhelmed by the idea of cooking. And so they just went out for fast food a lot. And we got a lot of responses that were like, I wish I could do this better, but I just don't know how. So a lot of educational requests there. And then we also had another category that we lumped together called quality of life. And this was a lot of people just saying, I don't have time, I don't have energy, I don't have enough storage, I don't have enough space, I don't have enough equipment or resources. And so we were really looking at this as what are the ways in which people can be supported in their daily lives, because cooking happens every day, right? This isn't a one-time deal. How can people be supported in their daily lives to have a better quality of life around food preparation? I think that that's most of the information about the community food assessment itself.
Thank you so much, Allie. That was a lot to summarize quickly and succinctly, and you did a great job. For folks who want to read the entire food assessment, it is available on the Mill City Grows website. If you go to millcitygrows.org and scroll down, it's about halfway down the page, you'll find the link. You can download the full report. And we're also working on publishing and disseminating some kind of short form infographic style, short kind of summary reports on each of those recommendation areas to really share the data and also the recommendations moving forward, how to move towards solutions to these challenges. So plug for that. There's so much to dig into in that report. It's tons and tons of data. But what we're going to shift to right now is we're going to dive into the wealth of expertise and knowledge and understanding that this group of people here today on our panel possess. And I'm going to, sorry, Al, I'm coming right back to you because, Mill City Grows is the host of this assessment. And so the question I have is, why did Mill City Grows decide to do a food assessment, and what were you hoping to learn and gain through the process?
Yeah, Francey, in your introduction, you talked about Mill City Grows being founded based on the assessment that you and Lydia did in 2011, 2012. And so we knew we wanted to do another one, right? 10 years later, we were kind of like thinking along the lines of the census. It's good to have data to know, did we achieve some of the goals that we've been working towards over the last 10 years? What has changed? What did we do differently? And what's new? What new factors do we have? And so a lot of the recommendations from that assessment were met. So, asking for more community gardens, for instance, we went from 1 to 8 community gardens. Just with Mill City Grows. I know that there are actually some other community gardens in the city as well, such as the CBA and the Lowell Alliance, and a few others. We also have, 16 school gardens in the city now, which are all, big shifts in the last 10 years. A lot of different programming, like mobile markets and our farm, and a lot of different things happening on the ground than they were 10 years ago. So we wanted to get a little bit of a new direction as well. After 10 years of basing our programming off of the assumptions of the old community food assessment, we felt that it was too far in the past to really be basing our decision-making off of that anymore. So we really wanted to do that as well. At the same time, the REACH LoWELL coalition started to form, which was a CDC grant, which Jean Merle explained a little bit in her intro, and really brought together a lot of people in both public health and food and nutrition services across the city. It was a huge opportunity for us to actually be able to do this work with the backing of a coalition, which turned out to be incredibly amazing, because we had a built-in team of people who were working directly with the people that we wanted to talk to as part of the community food assessment, that we could say, can you guys help us? Here's what we're working on. And they did help us in spades. That was just really good synergy, and funding came from that. I think that the really interesting thing is we also decided to do this in a pandemic. Throughout the entire community food assessment, we were very aware of the fact that we were looking at a really different and interesting moment in time in the city, and especially in the food system. That was going to change the answers to some things, but it also was a time when people were really willing to talk about this stuff. People were seeing people who had never experienced any form of food security before in their life were experiencing some of the things that some of their neighbors had been experiencing for years for the first time. And people were starting to be worried about that. During the course of the food assessment, food inflation went up in some cases by like 10 or 15 points. From when we started asking people questions to when we were doing the data analysis. I remember when we were writing the paper, Francey and I were like literally kind of looking weekly at the food inflation numbers, being like, can we even include this because it's so volatile? And so that had a really big impact. And I think that also had an impact on our decision to just do it, because there was so much conversation happening at the time about food access. And if any of you care to revisit 2020, there was this really big sense of people don't have enough food and we need to help. And all throughout the city, we really did help. And I think that had a large impact both in our planning and execution of the community food assessment. It has a large impact on the data. There is a little bit about it in there. We really talked to people when we talked to the emergency food providers, especially. We talked to them, how did COVID affect you, and the farmers as well. And the public also talked about COVID quite a bit, especially in the focus groups. So all of those factors together, we're now using the data that we received in the community food assessment to rewrite our strategic plan, and we're also giving these recommendations to the city at large. And we actually have had a lot of people reaching out to us about, can we do this programming? Can we do that programming? I'm like, yes, these are the recommendations. Please do the programming that suits it. So I think that those are all really great reasons why we undertook this process.
Thank you. That's there. Yeah. So many reasons and so much learning and sharing to really create some really amazing synergy around food access and food security. I'm going to go to you, Edith, because you're right there next to Allie. And you've been too quiet today so far. And I know you from being on the steering committee. So I'm going to ask you to share about your experience. Why did you join the steering committee, and what kind of sparked your interest about the community food assessment that made you want to be a part of it?
Well, Allie had a great deal to do with it. She came to my home and really laid out with a great deal of enthusiasm what this program was about. In the end, I said to myself, why not? I think we all bring talent and experience to the table. And I was very confident with what I had. I grew up in a household that had a large garden. My mother did canning, which was a big deal every fall. And when you grow up being exposed to that, you have a different respect for food. And as I said earlier, my interest is in feeding the homeless, people who don't have access to a kitchen where you can and put up food and store food. And I think the whole experience has made me see more clearly that we have a lot of work to do. And it's this group that I want to belong to, because their philosophy is helping people access good, nutritious food, whether it's in school, whether you're retired, whether you're a senior citizen, whether you're living paycheck to paycheck, or whether you're living, unfortunately, on the street.
Well, thank you for joining and sharing some of your valuable time with this project as well. You're a very busy person in the community. I'm gonna turn to Solomar, another busy person who wears a lot of different hats in the organization, but doing community food research is generally not one of the hats you wear, Solomar, at Mill City Grows. So what made you want to volunteer to be a part of the CFA last year? And can you talk about some of the goals you had in working with the community?
Absolutely. Thank you, Francey. Well, I do have a little bit of a background, because coming to the United States in November 2017 after Hurricane Maria in Puerto Rico, it was the strongest hurricane to hit in Puerto Rico almost a century. And I pretty much lose everything. So I established myself here with my two little girls in Lowell. I was considered a household with primary needs who needed, immediate support. But also acknowledging the fact that many other Puerto Ricans were going through the same thing and in need for services as I sat in a waiting room to get my own. Looking to be served at home, food, healthcare services, education for my daughters, transportation. I also saw in other Puerto Ricans the same need. But one that resonated was the need to understand the English language, not able to communicate well. So I knew that this was a real issue of social justice coming to this city. But that resonated well with me back in 2021 when Allie and you, Francey, presented me the opportunity to volunteer and to be part of the CFA project. I immediately felt the need to help the Latino community just because of that previous experience. So this was an opportunity to me to be a voice for this population worth listening to and acting upon. I knew I had to be a part of the process one way or another, even though I did not know what I was getting myself into. But what better way to partner with one of my colleagues here at Mill City Grows, and who I had a pleasure to also work with, Maggie Montoya, also a Latina. Nothing made us happier than knowing we will be serving the community, giving them the power of knowledge, but also a chance to speak in a focus group setting that we prepared. Our goal was to provide people a safe space where they could speak freely while being understood. So we had great, Spanish and Latino conversations. And we knew that this was an opportunity for a Martinez, a Rodriguez, a Perez, a Gonzalez, a Soto, women that were there with us, and they had a voice and a sense of expression to their own cultural food needs. And it was such a privilege just to create it all, plan it, brainstorm it, and have goals to just help them meet their needs as well.
Amazing. Thank you so much for sharing that. And I hear the passion in your voice and in your stories, and it's so inspiring. So I'm sure that that was communicated during your focus groups as well, and you really did achieve your goal. I'm going to bring the next question to Jean Merle, our resident healthcare representative. And we know that food is important for health, but I'm curious from your perspective, from the REACH LoWELL and from Lowell Community Health Center perspective, why is the CFA relevant to healthcare in Lowell, and how did the healthcare community get involved in the CFA?
Yes. I guess, after listening to Solimar's story and really with my experience working at the health center, you slowly start to hear those stories, right? And you start to notice really those social determinants of health really come out of that. And so really social determinants of health, I trip over that all the time, but they're really circumstances surrounding people's lives that really shape their ability to be healthy. And so that means the access to housing, water, and clean water, and really healthy foods. And so if a person does not have access to those resources, how can they be healthy? If you're hungry, how can you focus on your medication or on your diabetes if you don't have access to that food? And so, why healthcare really? Why is the CFA relevant to healthcare? Is really because in order for people to focus on their health, we really need to identify the common needs that people are having in our community, and we really need to know how to support them so that we can really turn the lens around and have them dedicate more time to their health so that they don't have to worry about getting food or accessing food. And so, healthcare organizations really need to start addressing the structures that are put in place that really make it difficult and that contribute to those inequities that are happening in people's health because of their inability to access healthy foods. And so the CFA is incredibly important, and it allows us to get that rich data. It allows us as people who work with communities to get down into the community and get to work and be there to kind of listen for once, listen to our community. So thank you.
Excellent. It was great. We had a couple opportunities to work with you and your colleagues from the health center, direct, patient care providers and community health workers. And it was really amazing to hear the richness that those individuals brought to this assessment, the stories they shared and these perspectives they shared from working at the community level. And that we know that food is such a a crucial aspect of health and wellness. We also have Tara here tonight, and my question for you, Tara, is about, again, what drew you to become involved with the CFA, and how was connecting with your community members important to you in creating a CFA that really reflected the entire Lowell community?
Right. Thank you. Thank you for the question. So I involved with CFA when I was working with CMAA as a civic engagement coordinator. My responsibility as a coordinator at CMAA was get people to vote, advocate for voting right in our city. But at the same time, my team and I have the opportunity to talk to community member, ask for their concern. What kind of thing can we work together to improve our community going forward? And around the area that we go out canvassing, talk to Cambodian American community member around the city, there are also homeless people all around as well that need the help and support going forward. And when one of my colleague from CMA back then, her name is Hannah Pan, she's a wraparound service project program manager. When I believe Mr. Girl contacted her to help pass out this survey, community food assessment, so we as a community can understand what kind of needed in our community. So I just bring my team along to help with this. We use paper to go out and talk to community members to fill out the survey, and especially our organization mainly focus on helping Cambodian American who just newly arrived to this country or need the translation and so on. So we use that method of speaking Khmer to community members to try and understand what kind of thing that the community need, and I believe it went great with the survey that we got so right now here.
Yeah, we were able to collect such an incredible number of surveys in the Khmer community, thanks to your help and your colleagues' help, and all the partners who contributed to the CFA through REACH LoWELL and throughout the city, the network of service providers. And that's exactly what we were hoping for, even in a pandemic when it was hard to reach people. The participation of you, Tara, and your colleagues, going out door to door in the community and reaching people. That's what it was all about. I'm going to bring the next question back to Allie, and I think everybody's kind of laid you up for this, Allie, through their responses. But I want to ask you what the core principles of the research were, and why did we establish these core principles? What was important about having principles in our research?
Yeah. So I think, returning to what I said earlier, we wanted to make sure that we were elevating the voices of people who are historically excluded from making the rules of society, right? From making the policy decisions, from making the financial decisions of society. And in Lowell, that included, a large part of the Latinx community and a large part of the Southeast Asian community. And we also had a core principle of, and I think that, we didn't always succeed, but I think we did take this to an extreme level. There's literally no excuse for not getting in touch with the folks that we know we need to get in touch with. And so, we are doing data collection, which is not anyone's favorite thing to respond to. And we're doing it in a pandemic where gathering in person is not recommended or even allowed for certain populations. And we're doing it in 10 different languages. And between the two of us, we speak like 1.5. And so we knew we needed partners. We knew we needed a lot of help, but we also knew that we needed to break a lot of the rules of standard research, right? We couldn't just say, okay, well, here's the very scientifically worded survey, and everyone's going to get it in the same context, in the same format, and they're responsible for responding to it. No, we needed to be able to interpret it well. We needed to put everything into plain language so that it could be easily understood and easily translated, because we translated everything into 10 languages, not just Spanish and Khmer, but also Portuguese, Vietnamese, Lao, Kiswahili, French, and Arabic. And I think I'm forgetting a few. And then we needed help getting it out there. So we really did a lot of stuff. I remember when we were forming the steering committee, that was one of the places where we really started to see how different needs would evolve over the course of the project. So when we were forming the steering committee, it was really important to us that the steering committee have representatives from all of the groups that we were trying to talk to. And so I remember we were trying to get a few Khmer speaking gentlemen onto the steering committee. And I was calling them with a live interpreter. They've been recommended to us by Niam Nikret, who is a community health worker at the Lowell Community Health Center. And I would be in the process of having a conversation with them, and I would say we're meeting on Zoom, or we're meeting virtually because we don't have the ability to meet in person right now. And I remember one of them saying, "No, that doesn't work for me. I would have to ask my son to help me with the technology, and I can't ask him for anything else." And so we really had to reassess that and say, okay, if we can't have everyone participate in the same way, how are we going to make sure that we hear these voices in the way that works best for them? So we ended up, instead of having folks from that community join the steering committee, we did individual interviews with them. And we asked them some of the same questions that we were asking the steering committee, and asking them to participate in some of the same work that the steering committee was doing, but from a different angle. We also, troubleshot a lot of different technology issues with other steering committee members. We bought everybody tablets. We paid everybody stipends. When we were really doing the big survey push, we were giving out $10 Market Basket gift cards for everyone to fill out a paper survey. We took them to the food pantries. We took them to the shelters, and we got like 200 responses from the Dwelling House of Hope because we were giving out gift cards, and people were like, "Cool, I'll take your survey for a gift card." But those were the people who we wanted to talk to, and we wanted to compensate people for their time. We didn't want this to be a fully extractive process. And we ended up having really good conversations with people too. Just really being able to, have them fill out the survey, but they were also like, "What's this project about? Why are you doing this?" And really be able to engage people on that level as well. We didn't want it to be a very siloed or secret process where the community didn't have a point of engagement. And, I think that also came out in the focus groups, where we had a focus group in Spanish and a focus group. Actually, we had two focus groups in Spanish, the one that Solimar did, and then we also had one at Panella Restaurant, where the chef was also on the steering committee. And we also had one in Portuguese. And I remember the Portuguese focus group was, the facilitator spoke Portuguese and Spanish, and then another person spoke Spanish and English. And it was like sort of passed through this chain of folks back to us. But we just worked with people in the way that they wanted us to work with them. And we were just very patient about that, and didn't try to push our own agenda, our own inclinations. We didn't always get it right. I think there were definitely some times when we failed, or we got something wrong, but I know that we held that as one of our core principles throughout the process, and really got a lot of traction with it.
Yeah, there was definitely moments where it felt very scattershot, in that sense that we were doing a lot of different things to reach a lot of different people. But that was our goal, was to reach a lot of different people. You spoke a bit about working with the steering committee. So we're coming back to you, Edith, about the steering committee. ask you what types of things did you do as a steering committee member, and what did you enjoy about being on the steering committee with the other members?
First of all, I only speak English. I understand Hindi, but I don't speak the language. So being on this committee and listening to people who have access to other languages, I think was fascinating and a key to the success of what we were attempting to do. I also think that for me personally, I like to talk to people. And one of the requests that I had was to go out into my neighborhood and talk to people who had gardens and photograph their gardens and, my neighbors. And that was really the highlight of, my small part of being on the steering committee, because I got to talk to neighbors and understand, why were you gardening? What produce did you get from your garden? And it engaged neighbors to talk to each other when I was going around, taking photographs. I think the steering committee on the whole, if someone were to ask me about this particular steering committee, very talented people with a passion. And I think no matter whatever the difficulties that we discussed, how we're going to do this and how are you going to get that out, I think passion overtook any ability not to get the work done. And that would be the highlight and the reason I liked working with this steering committee.
I remember a few of those virtual meetings that went well beyond our time limit, and everybody just had so much to share and so many thoughts. And we really got to hash out some of the big questions, when we were forming our survey and creating the focus group questions, that your input was so valuable and really shaped those foundational pieces. And it was just a wonderful process to engage so many different voices at a deep level. So speaking of the focus group questions and interview questions, I want to come back to Solimar and ask you to tell us more about your focus group. How did you organize it, and what were the elements that you wanted to include, and why were they important?
Oh, absolutely. Well, first of all, we parent with Ebenezer Church in Lowell with Pastor Cecilio Hernandez. And I also did a focus Spanish group in the Coalition for a Better Acre. So they both were a part of the initiative to organize the Spanish focus groups. And if you've been around Latino, you may know that us Latin Americans love a good food center gathering. So that was part of, making it more, nice and cozy and just welcoming for all the people who gather with us. Maggie and I knew that, this was very important to feel people just, at home and comfortable to speak in their own language. That being said, wholesome, nourishing cultural food was a must. In addition to setting up a cozy environment for everyone at that focus groups, we recognize the fact that the information could not be presented only, with words or just presented with a survey in a paper. So we needed pictures, we needed videos in the background. We kind of make it more a little bit personalized. We share personal stories, and we needed to ask questions in the simplest terms. So we also translated the survey to English into Spanish. Which was one of the highlights too, because there was a lot of discussions every time we just concentrated in a specific question. So providing images and sharing personal experience helped the information digestible for Latinos. So that was part of it. We were right in doing so, since our focus group responded to a lot of our questions and everyone had something to share. When we brainstormed about it, we just knew that we had to explain what food justice is. We needed to discuss terms of barriers for people in getting their veggies. If food was affordable, we had to, just ask, what does healthy means to you? And how can we supply the need for the Latino community? And how do we better communicate benefits and how to use them in our markets? And that said, there were a lot of answering to the SNAP and HIP and WEAK benefits as well. So these were all questions and answer we were able to collect and help to input as the outcome and impact for the Lowell Community Food Assessment data.
I love that. I love that it was such a dialogue, with learning happening on both sides of the facilitators and the participants.
Absolutely. And very interactive. Latinos are very loud and we like to speak.
Well, it shows the care that you put into it was effective in eliciting the response and the participation of the members. And we're so lucky to have you on that team.
Thank you.
Tara, I want to ask you again, a little bit more about, what challenges or specific, specific obstacles you faced in reaching out within the Khmer community, in administering surveys and doing interviews, and how did you address those, or what strategies did you use to reach community members?
I think that one of the struggle thing, challenging thing in our community is the language barrier between our community. But with the great idea and the great partnership with Milsico and with CMAA, CVA, and with many other organizations, nonprofit organizations in City of Lowell, we were able to gather the languages. Like CMAA can focus on Khmer people, on speak Khmer to Khmer community member in our community, and that's what we did. We go out with those survey on paper, speaking Khmer to Khmer folk on try to explain to them what is the purpose of this community food assessment. And everyone that we talk to, all nice people, and they really engage with the conversation and the survey. And with one person that I encountered with while doing the survey at the Clemente Park, so known as Byland Park, he expressed that he liked to grow his own thing at his home with his family and this kind of stuff, but he would like to know more resource on how things can be easy for them to grow those food at home. And so my mom do the same thing. So my mom just bought a new house, and sooner or later the backyard can be full of food that she's gonna grow over there. But with the resource that Milsico working on passing out to the community, that would be great on how we can do this going forward, our community, in our community. And I like to say that with this community food assessment, it's gonna lead us to understand more with the different cultures around our community as well. Different culture mean different food. People cook differently, and we cannot judge them. All food is the same. Not the same, but it tastes good. So we should value them and respect people on the different culture and different food in our community. And if you have not tried Cambodian food yet, please go. It's really good. It's everywhere in our community.
That's so true. It's one of the things I miss most about not living in Lowell anymore, is the delicious foods of all the different cultures and community members. But thank you, Tara. That's great. I love hearing, again, that kind of back and forth, and that it wasn't just about taking information from people. It was really sharing and learning on both from both perspectives, and how personal stories can connect, and how talking to a community member about your mother, like that, just builds the trust and builds the connections, and we really we know that can be so effective in making any kind of progress. Jin, I have one more question for you, which is, again, this kind of strategic question about what strategies were used to reach different communities across Lowell through this food assessment? And was there anything that was new to you that you learned about effective community outreach and engagement in the healthcare setting or otherwise?
Yeah, I feel like so a strategy we often use is like meeting people where they're at, regardless of where that is, especially in high foot traffic locations. And often those are places like community-based organizations and faith-based organizations, and making sure you're including them in the process of outreach, right? And oftentimes it's in places that are not necessarily the usual place to do outreach, and sometimes we have to really get down into the community and actually so that we can get the information that we want to get and reach our community members and support them where they're needed. And I think a different way for me was really going to Roberto Clemente Park or Pineland Park, and we've done things like that before, but I think previously we haven't gone to usually it's where an event is happening. And this time we kind of went organically and met the people who were already there. And it was something like, they didn't expect we were going there. And so when they saw us, some people were like, oh, who are these people? And why are they tabling? And the important thing too to think about is our community health workers and our community outreach workers and people who are on the ground doing the work, and how oftentimes, especially at the health center and in a lot of our community-based organizations, these people reflect our community, right? The people we work with really do reflect our community, and that provides a sense of, safety, a sense of trust with a lot of our community members. And especially when we go in with our jeans and our t-shirts and we look like normal people, that really helps provide that safety and reduces that intimidation factor that comes with really disseminating a survey. Having a clipboard and, our badges, that's really intimidating. But when we go like, hey, we're actually just here to hear about you and your experiences, and it becomes more of a conversation, then here's a paper, fill it out. And it also speaks to the importance of language. And I think it's been touched upon several times here in translating things and even interpreting or providing information in the target language. Even if someone doesn't read the language, right? And having that language present at the table, that's like, wow, they really care about my opinion, And so we learned that. We learned that just having the conversation in the target language really mattered. And that, really being able to get out there in maybe in an uncomfortable situation or comfortable situation and just doing the work because it's important. And then another thing, I did mention that our CHWs really reflect our community. So oftentimes at the health center, we leverage that coincidence, right? So a lot of the times we leaned into our own internal resources and, checked in and asked those same questions, hosted focus groups within the health center to hear more, because they're almost our window into the community as well, right? So that's the beauty of it. They're already going to work. We can take, we can take some time to kind of talk about the needs that they're seeing within their neighbors or their family members, and we can work on addressing them. So yeah.
Awesome. It's I love the point you made about the translations and people really feeling seen and respected and valued. And I think that was really our intention in all of this work, was to really help people, or to communicate to people that we did see and value them. And this wasn't just about, give us your data and, we don't care for you as a person, but to really, wrap people in that sense of being cared for. And that, food is one of those things that does that too. So I love hearing about Solimar's food at her focus group. And, there's all those little touches that all of you did to make this assessment resonate with the community. I'm going to open it up at this point to our panelists. If there's any last input, any connections that were made today that felt new or meaningful, or that you just want to share out, or any thoughts that you have that you didn't get a chance to speak on. We have a few minutes before we jump into the Q&A. So if anybody has anything to bring.
Yeah, Edith has something to say.
So after 2 years of being really, really quiet, the Lowell Folk Festival will happen again this summer. And, it's the kind of event where I'm selling my Jamaican meat patties, which I happily swap for a Cambodian bowl of rice. And it is that excitement. It'll be my 36th year of being involved in the Lowell Folk Festival. And that is when all of the food ethnic booths really come together. And I think it's the culmination of really community having fun, where food is the prime draw to the folk festival. So just to remind everybody that it's coming last weekend in July.
Thank you.
Thank you. That's super exciting.
I also just wanted to add to Jean Marlee's story when she was talking about that was a really cool day in Roberto Clemente or Pineland Park when we did tabling. But she was like, oh, we just did it organically and there was no event. But we went during volleyball time. And I think it's really important to note that we knew what we were doing. And, the Cambodian community health workers were like, just go during volleyball time. You'll get 50. They were like, it's no problem. Just go then. And so really, understand your community, know when people are going to gather, know when people are going to be organically in a space and in a good mood and in a community focused mood and ready to talk. So things like that.
Mm.
I also just wanted to shout out again, obviously this was much more about methodology of the community food assessment. The whole 100 and something page document is up on our website, millcitygrows.org, along with appendices that show, all of the graphs and data exactly as we got it, and a lot of interpretation in the text. And then we will be sharing some infographics in the next month or so, which will be translated into multiple different languages. We're working on translation for the full document. And we are also currently recruiting for Food Policy Council. So we have made a number of very staggering recommendations in the community food assessment. And so we're now assembling a council to help bring those recommendations to the city at large, to city, state, and whatever other government bodies might be relevant, and also to make some recommendations on what should be the first projects going forward. You can also find more information on Food Policy Councils generally and how to apply to join ours on our website, millcitygrows.org. Excuse me. And Catherine just shared the link in the chat.
Great. Thank you. Such important follow-up. This is not the end. This is just the beginning of this work. And the Food Policy Council is a great way to be involved and even just to kind of stay tuned and follow along with what that council is going to be working on. We do have a few questions that popped up in the chat, so I'm going to go through. Thank you to Catherine for keeping them at the top of my list. So Sarah Kuhn asked, do you have any collaborators who might want to write this up for sharing with other community groups? Yet more work, I know, but this could be a model. So that's a really good question. And it's definitely something that we have gotten questions about, specifically working with the REACH LoWELL Coalition through the CDC. There definitely has been, we have gotten questions from CDC partners and technical assistant providers who have requested that we do write this up. So it's on the list. Hopefully we'll get there at some point this year, but we've been focusing on getting the CFA published and starting up the Food Policy Council locally and kind of keeping the momentum behind this project going. And we will get to the documentation part of the methodology as well. I don't know, Allie, if you have anything else to.
Yeah, the CDC has asked us to write a success report on our work here, and I think that is part of what will be included there. We have presented to, so the REACH Coalition in Lowell is just one of many coalitions across the country, and there's also there's REACH HOP, and another one that I can't remember the acronym, and I always want to say SKIP, but I don't think that's it. So there's a number of different CDC initiatives across the country, and we go to these massive national online convenings where there's dozens of different people doing this very similar work. So we have been asked by the CDC to do some of that work, and like Francey said, we're taking a little break, and we'll probably get back to it at some point this summer. There is a good amount of methodology also in the report, though. So we did do a fairly lengthy write-up of the methods that we used and the populations that we reached in the report. So you can certainly get the high level there.
Thanks, Sally. We got another question that came in from Caitlin Sullivan. Caitlin asked, any feedback from participants on what it was like to be asked and share their experiences, needs, etc., given that they aren't traditionally asked or included? So I don't know if anybody has any stories or experiences to share about feedback from a participant, from a focus group member, or somebody who was being surveyed or interviewed.
I can share. I think there was like a little bit, I can't pinpoint a specific person, but I know out of conversation, I think people are really wondering, like, is there something going to happen with all this data that's being collected? And I feel like I hazily remember a conversation like this, but and the answer is yes, right? There's things even before the assessment was done that there was goals to do with it, and I think people are really just looking forward to all the work that's going to happen in the future, while like wondering like, oh, what is going to happen from all this data? Because it is a very extensive assessment, and so it was really, really detailed, and people were like, wow, like you need to know this, or like you need to like this question had never been asked before. But that also speaks to like the extent of like this assessment and how deep we were getting, so that eventually we can really inform a lot of the work that's going to happen in the future. So I think people were wondering almost, but hopeful. I think like in the conversation I had, like I was making sure to let them know that there is going to be work done and there's already plans, like don't worry.
I led the focus group at the senior center, and they were a very lively crowd. And after we were done with the focus group, a lot of them came up to me and just wanted to continue the conversation. They were just really engaged and really excited, and they were grateful to have been asked their opinion, because they weren't always asked their opinion. So that they did actually also fill out the surveys, because the surveys were different than the focus group questions. But the conversation generated was really good. And they actually didn't know that they were going to be given gift certificates. I had told the people who recruited at the senior center to let people know that they were going to get, I think it was a $25 gift certificate for participating, or possibly it was a $50. And they didn't know until the end. So then they were also just like, wow, and we get, a prize. So that was pretty exciting.
I've got a few other questions coming in from the audience here. These are great questions. This is another question from Sarah Kuhn. What are your recommendations that you think will have the most impact?
Some of the biggest recommendations to me and some of the biggest impact to me is a lot of data that is showing how people want to access food in a way that is affordable to them. And a really staggering piece of data is, Francey, do you have the number? 70 something percent?
80%.
80% are looking to find solutions that allow them to purchase the type of food that they want to purchase, not solutions that give them free food, because free food solutions are more limited in scope. And that's a pretty big shift in the emergency food system, in food access work generally. So really talking about, how can we make sure that people can get exactly what they're looking for, And also, how can people engage with food access through the model, through the modes that are seen as normal, right? So destigmatizing food access. So that was a really big part of the affordability recommendations that I think we're certainly going to be pushing forward. There was also just a lot of really interesting and good information about retail and how we could improve retail access in the city. That was everything from like fix the sidewalks to make sure that there are fresh vegetables in corner markets, to make sure there's culturally food accessible in supermarkets. The really wide-reaching recommendations that we can take back to hopefully that we can take back to business owners even and say, hey, we asked quite a few people their opinions about this, and this is what they said, and some of them are big enough swings that if 800 out of 1,000 people said that they want more vegetables more than anything else, you might want to carry more vegetables and just figure out how that can be done better.
Mm-hmm. Yeah, definitely. I think that was the thing that really stuck out to me the most. You hear a lot of data or, reasoning that selling fresh produce is not profitable. It doesn't make sense, business sense for business owners. And yet if the consumer wants fresh vegetables and fresh fruits, it becomes incumbent upon the businesses to meet that demand. And so then that kind of goes to the next round of questions. Well, how can it become viable for small business owners, corner stores, bodegas to carry fresh produce? What are the barriers? How do we kind of unravel that knot that has made it so difficult right now for those kinds of products to be available? All right, I've got another question here from Kim Castens, who asked, what will be the next steps to move toward implementing the many great recommendations in the report?
That's a great question.
Yeah, that is a great question.
A couple of steps have already been taken. So one is the Food Policy Council. I think that's the biggest thing that Mill City Grows is doing. We've also, I have been in my work just quoting this research for months now. Quoting the SNAP gap, quoting the HIP gap, really bringing those to the front of the conversations. Our research is being included in the community health needs assessment that's being done by Lowell General Hospital right now. But also, Mill City Grows isn't the only ones doing the next step of the work. So I don't know if Lil is on the call from the Senior Center, but she's really organizing, food benefits awareness, and she's using this research to really push forward some of the initiatives that are going to help her Senior Center members. I know that there's people working in different sectors around the city who are looking at the research and saying, yeah, this data, helps me prove something or helps me focus something. And that's really what we want to see. We don't want it to just be, we're a very small organization who is very focused on food sovereignty and food justice. We don't have the ability to take this whole recommendation set and push it through, but we have a lot of partners who are very interested. UMass Lowell has been taking a look and trying to figure out how they can use it in their work. Some of the bigger players in town are really starting to take a look at the research and hopefully working through it themselves.
Yeah, and in the report, you'll see that each section of recommendations is kind of grouped as grassroots, kind of organizational, institutional, and policy. And, thinking about that breadth of, what the different targets are and the different goals are. I want to ask Tara, as he's embarking on his campaign for state representative, to just give us a little bit of his perspective on the policy aspect, how policy plays a role in food access and food security.
Thank you. I think my personal opinion that the state government can come in and help improve this, working with nonprofit around the city and the state to make food insecurity not a thing. Give people accessible to get food and affordable food so they can put on the table for family to eat every night or every day. And if I end up got elected to be the state representative, that's the hope, that the fighting for what is right for our community, the fighting to help bring the state government to come in, offer support to nonprofit like Mill City Grove that are working on this issue to help improve food justice in our community, food insecurity in our community. Because since Lowell is one of the diverse city in the state of Massachusetts, there are many people that have lack of resource, lack of support on all of those issues around our city. And especially people who just newly arrived to this country. Thank goodness that the city is full of, our city of Lowell is full of diverse business owner, diverse people all around, that people can feel connected when they come to the city. But imagine you come to this country with no support, no one look like you. That would be tough. And we cannot just we cannot just talk and not do anything about it. The state government can do much better if they're willing to take that next step on come into our state and each city and ask for help, ask for how can we work together to improve this issue going forward. And that's one of the things that I want to improve if I got elected. I'm not here to advocate for my campaign. I'm here as a board member for Mill City Grove, but I'm also running for state representative to find a way on how we can do things better in our community.
I have something to say. Go ahead, Edith. I think that when we talk about small convenience stores that don't seem to have fresh fruits and vegetables, we're coming into the summer pretty soon, and it would be good to engage with local farmers more than we're doing. I've gone to the market that they have in front of the city hall from time to time, and there is just not enough produce. You have few farmers who are bringing their produce into town. Now, when you sit down and do the kind of work of data gathering and surveys, this is the basis of looking for grants from your state. And our friend here who's going to run for state representative, I'll be watching you. It is the state representative who has learned the needs of the people, as you have been doing and being engaged in this kind of work, that you do take to state government and tell them that we are in need of, whether it's more farmland in this city to farm, to be able to feed people, or whatever the needs are. I really truly believe that there has to be an intersection of local farming and the city's
Definitely.
needs for food.
That's interesting. We have a question in the chat that came right to that point. Dan O'Connor asked, is Mill City Groves planning to pilot supplying produce to corner stores and bodegas for retail sales? So I'm going to give that question to you, Allie.
Yeah. So there's been various corner store initiatives over the last 5 years, largely through Massive Motion and also through the WIC office. And there's been a number of challenges with those. So we're very aware of that work that's already been done. We're interested in seeing what could be the next iteration of this, and really how can we bring some of the things that we've learned in this process and some of the methods that we've used in this process to work with the corner store owners and the business community better. That being said, Mill City Grows will not be sending our produce there because our produce is spoken for. Pretty much 100% of our produce goes out the door in our mobile markets and our CSA and our other programming. We only grow on about 5 acres of land in the city. However, as part of the community food assessment, we actually did do a pretty robust assessment of the local farms, and we used local to be within 30 miles. Right. And so we actually generated a list of over 200 farms. one of our staff members is now leading a growers aid program in the region. And this, in part, this program just kind of materialized last year out of some of the research that we had done, out of his own conversations with largely immigrant and refugee farmers working in Dracut, in Chelmsford and Westford. And we're doing a lot of trying to look at the regional produce system, because there's no way that Mill City Grows is going to feed the city of Lowell. We're small. We're demonstrating different types of agricultural practices, but we're not going to produce enough food. The most food that we can possibly produce, which we did in 2020, is about 45,000 pounds of food, which feeds less than, probably maybe 15,000 people partially. So we're looking at, what are the larger regional exchanges that can be happening? And, some of the recommendations are like, should we be looking at a food co-op? Should we be looking at a food hub? There's a few of those opening up regionally. We're also just, we got some really important feedback from farmers about why they don't come and sell their produce in Lowell, like Edith just said, and they're good reasons. They don't have the staff, they don't have the time, they have better markets elsewhere. So how do we make ourselves a better destination for people? And I think that actually is a big part of the retail and farmers market analysis in the report is around that work. Because Lowell deserves a robust farmers market. Lowell deserves robust produce stands, robust produce in corner stores. We do have this beautiful system of very well-rounded, small cultural markets throughout the city, and especially in the Highlands. And they do provide some of those things. So how can we support that or make them even more accessible or better stocked? What resources do those small business owners need?
Thank you. I think we are coming to the end of our time together today. I don't know if there's any one last question out there. But just to let everybody know that this was a recorded webinar, and I believe it will be shared and made available. And as Ali and Catherine both mentioned, the full report is available from Mill City Grows website, and we will be launching the Food Policy Council in the coming month or two. So stay tuned for that. So there's a lot more to come out of this, and those infographics will be coming out as well. That will be really, well organized and easy on the eye, so you can get a lot of information in a short period. And I just want to thank our panelists today, a fabulous group of individuals working on behalf of the community. What a lucky community Lowell is to have such dedicated and just passionate and energetic people who are working every day to make Lowell a healthier and better place to live. So thank you all for participating today. Thank you everybody for coming. Thank you to all the 10th anniversary event sponsors for making so much of this possible. And I hope everybody has a wonderful rest of your afternoon and evening, and a good weekend on the horizon.